welcome to the Nursing Post podcast, All Nursing All the Time, with Ashley Moore and Rosa Horsley. In this episode, we will discuss our correctional healthcare system. Our goal is always to inform and help start conversation.
Do you know that inmates are the only people in America with a constitutional right to health care?
No.
Well, if you didn't, we're about to have a little bit of a history lesson. So legally, because of the Eighth Amendment rights, people in corrections have a right to medical health care access.
Right.
The standard of care that incarcerated people have a right to receive care was established in the landmark case of Estelle versus Gamble in 1976. The First Circuit Court of Appeals defined in 1987 as adequate care at the level reasonably commensurated with modern medical science.
Right. So what they're stating is you can't just take care of them with pretty much old statistics or old medicine. You have to, prisoners or people who are incarcerated, whatever you want to call that group of people, they have a right to health care, and it needs to be relevant health care.
Yeah, not something that was practiced in 1920.
Right.
It's 2020 now. There's a lot of medical advances, so
right.
we're gonna treat as if it's 2020.
Right. So they pretty much get the same health care that you or I will get, and they're the only American that's actually entitled to health care, which is kind of ironic.
It is, and it's probably a whole podcast episode in and of itself.
Yes.
Because it's has a lot of opinions, for sure.
Yes.
But not only is it a legal right, ethically, it's the right thing to do.
Well, right. I mean, healthcare providers should provide health care to everybody and anybody.
Regardless.
Period.
Yeah. I mean, they
everybody.
Take an oath. Didn't it? Yeah, they take an
Just
oath.
Everybody.
So that's what you do. You care for everybody. The AMA sought to establish uniform standards, which in turn led to the creation of the National Commission on Correctional Health Care. So these were physicians who, were going into the prison system, the correctional system, noticing that, the inmates were not receiving adequate care, and the AMA, which is the, American Medical Association, was like, we need to change this. Like, this isn't right. Everybody should be able to have standard health care.
Sure.
So now, because of that, every day in correctional care companies throughout the United States, if an inmate has a complaint like a headache or they have a minor injury, nurses can wheel medication carts from cell block to cell block and dispense over-the-counter medications and prescriptions for people who are sick, or submit, written jail requests around the clock, like through the direction of a provider.
Right.
In rural counties, they appear perhaps once or twice a week for consultations. And when there's no doctor present, one is usually on call to consult by telephone in an emergency. And in situations requiring surgery or more complex procedures, correctional care companies are supposed to send patients to the hospital. They're supposed to.
Right. Well, if you can't take care of the situation immediately and it's urgent, what emergency rooms are for.
But a distinct feature of correctional health care is that incarcerated people believe that their health or their life is in jeopardy. They just can't get into the car themselves and go to the emergency room.
Right. So that's, I think, the whole reason behind having an amendment that states that people that are in a correctional facility have the right to health care, because they're the only people who can't just take themselves. They can't be their own judge. They have to have somebody else do that because of whatever situation put them in jail. So because of that, this is their only protection against really being
not receiving the care they need, really,
and being mistreated.
Absolutely. We can get on the phone and call 911.
Right.
An ambulance is going to come and get us and take us to the hospital if we so choose. But they don't have that luxury. They're depending on the guards,
the staff,
and the staff, medical staff, to do the right thing and get them the help that they deserve.
Right.
So what happens when the company gets to decide whether the care that's provided and who pays for it? Like, who determines that?
I think that's kind of been an ongoing issue and reason for a lot of people's opinion on healthcare in this type of setting. But there is an option. Well, there is a means for profit in this type of organization. So people are not going to jails and prisons out of the kindness of their heart to treat people because they need fair treatment. They're doing it for profit.
Everything usually boils down to the bottom line.
And I'm not saying that they're bad people. I'm just saying it's all a for-profit organization. And the National Commission on Correctional Healthcare, which accredits programs in the correctional facilities around the country, about 70% of the jails that it inspects outsources all their medical services, and they're outsourced to for-profit companies that have a sizable share in those contracts. And the companies negotiate, yearly, bi-yearly, or however long the contract is, with each jail and prison that they serve. So just kind of like the way doctors' offices and insurance companies kind of contract payment is what that kind of reminded me of. But medical staff, prescription drugs, outside services, like somebody falls or breaks something, that's going to require a hospitalization and surgery. So those kinds of costs, the companies offer a per diem or like a per individual rate. So the profits depend on holding the cost below that amount. So they're going to try to do as much as they can within the facility that they're already paying for before they try to outsource it to these larger companies, because that costs more money.
They're not making a profit at that point.
So sometimes those contracts include provisions that increase the company's potential for profit, if it holds down transfers to hospitals or other outside providers, which is the issue that we get into with why, yes, they are entitled to treatment, but they're not really getting the best treatment because those for-profit agencies really want to keep costs low.
Yeah, that's how they're making money. The less care that inmate receives, the more money they get.
Right.
Because they get to keep what's not spent on that individual.
Right. Yeah. And Rosa and I really try to be really fair when we think about these different topics, and we do a ton of research, and anybody who's ever looked at our show notes and sees all the references,
we read a lot.
We actually read all those.
We read a lot.
And use bits and pieces to try to make it as fair and open-minded as possible.
We want you guys to come to your own conclusions. We want you to ask the questions to start the conversations.
Right.
We might plant a little seed here and there, but in the end, if you read and you research, we want you to come up with your own opinion.
We feel it's our place to provide facts. And so part of the facts and what resonates with us are statistics. And I think we do this every episode. It's statistics of some sort. One of the things that I found with the statistics involving the correctional facilities is it can be quite different depending upon where you go. So I kind of did two separate sets of statistics for this one to try to make it as fair and unbiased as possible. Yeah. The one thing that set across the board is there is an overwhelming majority that shows that inmates were male. They are younger than 35 years old, and they are disproportionately Black or Hispanic. So you're looking at young Black and Hispanic males is what is
the
really,
majority of the population that's currently confined.
Right. Yeah, absolutely. So that's kind of one of those big things. And another thing from the 2017 Bureau of Justice, half of the people held in jails suffer from some kind of mental illnesses. So that's kind of big. And more than a quarter have severe conditions like bipolar. So not just like a touch of depression, which is considered a mental illness.
It is.
But these are like bipolar disorder, which you have the really big highs and lows. And that same year, the Bureau reported about 2/3 of jail sentences where inmates suffer from drug addictions or some kind of dependency. Mm-hmm. And that number is from 2007, 2009. And so it doesn't take, what I'm trying to say is that number doesn't even take into consideration our opioid crisis.
Yeah,
that's more recently.
Through.
Yes. Right. So that number, the numbers are not out yet because I think we're still in the middle of that and working on it. But I have a feeling that number's going to be a bit higher.
Side. Yeah, on the high side. So from the Bureau of Justice, it's estimated that 44% of state inmates and 39% of federal inmates reported a current medical problem other than a cold or virus. Arthritis and hypertension were the two most commonly reported medical problems. And among inmates who reported a medical problem, 70% of the state and 76% of federal inmates reported seeing a medical professional because of that problem. More than 8 in 10 inmates in state and federal prisons reported receiving a medical exam or a blood test since their arrival. Almost all state and federal inmates reported being tested for TB. More than 1/3 of state inmates and nearly 1/4 of federal inmates report having an impairment. So learning was the most commonly reported impairment among state and federal inmates. 16% of state inmates and 8% of federal inmates reported having multiple impairments. So what I get from that is I might have diabetes, I might have hypertension, and I might not be able to understand any of that.
Right. And so that was kind of, it kind of opened my eyes to the thought that our prisons are holding people who have learning disabilities, drug addiction issues, and mental health, which means if we work on fixing our mental health crisis, we don't do a good job with our mental health here in the United States, in my opinion.
I agree.
And so if we worked on getting better within our mental health, healthcare, and we worked with recovery for drug addiction, for drug addicts or people with dependencies versus jail time, that would be a huge shift out of our jails and into like rehab facilities, and then teaching people and educating them properly from day one, which starts, at home and then into the school systems, is huge.
Absolutely.
And so it goes to show you how some things that are not healthcare related very much impact healthcare. Yeah. From the National Library of Medicine, they had their own statistics for corrections. Among inmates with a persistent medical problem, 13% of federal, 20% of state, and 68% of local jails, jail inmates had received no medical examination since incarceration. So it looks like the federal side is doing the best, but when you look at your local jails, you're looking at nearly 70% have not received any medical exam. That's kind of a large number. More than 1 in 5 inmates were taking prescription medications for some reason when they entered a jail or prison, and 26% of federal almost 29% of state and almost 42% of local jail inmates stop the medications following incarceration.
You know, that's something serious, because if you are bipolar, your medication is what stabilizes you.
Absolutely.
And then to pull those medications and not have them available while you're incarcerated, that's just bad medicine all the way around.
Right. And we already established that about half the people that are in
Have
a facility
a mental
have a
health issue.
mental health issue. And only a small portion of prison inmates, almost 4% federal and 6.5% for state, with an active medical problem for where labs are needed routinely, had not undergone any test since incarceration. Which really, as nurses, we know the effects that can have. And most local jail inmates with those conditions had not undergone blood tests either. So again, and that's 60%. So there's still a big difference. You're going 4 for federal, 6.5 for state, and then you're jumping 60 to your local jails. So it goes to show you the biggest difference. I mean, the federal prisons have their stuff together immensely
A lot
more than the local jails. And
maybe that's because if you've made it to the federal pen, I mean, most of the time that's a long-term placement.
yes,
So there's some consistency, I guess, to be said in that.
right.
Where jails,
They're coming and going.
They're coming and going like a revolving door.
Yeah, absolutely. And so mental illness was a problem across the board with all facilities. Most with at least one diagnosis of mental illness were not taking their medication at the time of arrest. So that goes to show you, no matter where you're going, and we know that mental illness is an issue, these people are not being taken care of, which goes back to me saying that's why I think that we really don't do a good job with our mental health care in the United States.
I totally agree. I feel like a lot of times people with mental illness, whether it's, depression, bipolar, schizophrenia, most of the time when you go to the emergency room, it's like a Band-Aid effect. Let's see what we can do to fix the situation right now. But
Right.
with those types of patients, I mean, there has to be follow-up on the back end.
Yeah, and I know, and I understand it's hard. And working with mental health, the patient has to want to get better, and there's a lot of ins and outs. And I think unless you've directly worked with some patients who have mental illness, it's hard for you to sympathize with the fact that their mental illness is the reason why they're choosing to try to not get treatment.
Mm-hmm.
The paranoia and things like that. So it is a really tough place to be in, but there's got to be a way to make this better. There has to be a better ability for providers and nurses to make those connections with the patients. So then that way the patients actually trust them as individuals.
Absolutely.
Because, when you build that trust and that rapport, that's where that healthcare can really shine.
Mm-hmm.
So
I agree with that. So how do we reform this healthcare system, and what will it actually take?
well, I think there's a couple of places to start. And mental health and substance abuse is going to be right at the top.
Absolutely. Absolutely. So both jail operators and private healthcare companies recognize that it would be better to treat mentally ill people, especially those who are nonviolent, in appropriately specialized hospitals or even in dedicated units in the jail. Okay. Mm-hmm. But building those facilities and hiring counselors and, psychiatrists and staff, requires government funding. And a lot of us here in the States don't have that federal funding to go that extra step. So we need to do better. Mm-hmm. We need to do better. Lives are being lost. In 2015 in Texas, Sandra Bland was pulled over by police for a routine traffic stop. She failed to signal a lane change. The encounter became vocally confrontational when the officer asked Bland to put out her cigarette and after refusing to do so, the officer opened Sandra's car door, ordering her out and threatening, "I will light you up," as he was pointing a taser at her. The officer repeatedly yelled at Sandra to drop her cell phone as she was recording this incident. Sandra Bland previously attempted suicide after the loss of a baby and was feeling depressed on the day of her arrest. This is according to a handwritten jail intake screen from Texas officials that had been released in the news. Sandra Bland committed suicide 3 days after her arrest in her jail cell by hanging herself. The commission released a report noting that Waller County jails had been non-compliant after an investigation that was prompted by Bland's death. The report noted that jail staff had not received the required 2 hours of annual training for the detention of inmates with mental health problems or who were suicidal. The jail also did not comply with rules requiring workers observing inmates face to face every hour. Instead, jailers were conducting those checks via an intercom. Sandra Bland's family filed a lawsuit against Waller County jails and received a $1.5 million settlement. Her family, along with activists and lawmakers, helped the state revise their intake screening process of county jail inmates to better identify those who have mental health issues. In 2015, the Bland Act mandates county jails to divert people with mental health and substance abuse issues towards treatment, making it easier for defendants to receive a personal bond if they have a mental illness or an intellectual disability, and requires that independent law enforcement agencies investigate jail deaths. This is a major move.
Absolutely. I mean, no matter whether or not the arrest was warranted or not, the fact that she was screened and was at risk from the screening tool and that failed after that, that's where the problem lies with this. Is we knew she had an issue with depression when she was in the jail, but yet she was left alone. To the point
they should have been making physical checks on
right.
her, and they failed to do that.
Right. So that's where the mental health aspect and incarceration are really two completely different entities, and we have already established they really need to work together.
They need to be integrated.
Much more effectively.
They need to be integrated. In the bigger federal penitentiaries, they do have, units for mental health.
Right.
Floors or cell blocks or however the lingo is. But they do have that. They do have mental, institutions in federal penitentiary for people who have mental illness. And I understand that's
right.
very difficult to do in jail because those are, people going in and out the door. But if that's an issue and they have a mental health issue, then maybe their first step shouldn't be jail. Maybe their first stop should be at, a mental health facility.
Right. I mean, you don't know when somebody's arrested what their situation is. Mm-hmm. But once that person's arrested, if they're getting screened, if it's a positive screen, then maybe you need to go down, road F instead mm-hmm. of road X.
Absolutely.
And then that way we're automatically separating people who we know have a positive screen. I mean, something like that is like the first thing that pops to mind. And I'm sure there's somebody out there who goes, oh, she doesn't understand the system.
Probably.
There's a lack of education. But I know enough to know that if, the whole point of having a screening is to do something with it.
Mm-hmm. Well, it's useless if you're not going to use it. Yeah. Why did you waste your time doing it?
Right. To check the box to say you did it, but then you didn't do anything with it, it's a failure. I mean, in this case, it was a $1.5 million failure and a loss of life.
Yeah. And her family loved her so much. As during these times right now, say her name, Sandra Bland.
Right.
Honestly, this is a documentary. Her case is national. She's documentaries on HBO. Like, this is one case out of, I can't even count how many.
Right.
Because she's not the only one, and she's not the first. Unfortunately, I don't feel that she will be the last. So something has to be done. And the fact that Texas is now having to own their crap and say, listen, we messed up.
Right.
So we need to do something to prevent this from happening to the next Sandra.
Right. Which, I mean, everybody needs to learn from this, not just one state or one entity.
This needs to be nationwide.
Exactly.
And I saw the video. I don't want to get into it. It makes me emotional.
Well, yeah, because these are people. And I mean, she was just lucky enough to have a family that was so supportive of her that they made sure that they took it to the spotlight. You know, and a lot of people, especially people with mental health, don't necessarily have that.
Absolutely.
And so
they don't have
that's
enough
where us
advocating.
Nurses are trying to be advocates for those people who don't have that. That's why we take the abuse from a lot of these dementia patients because we're going to come up with excuses all day long that they can't help it. Or for mental health patients, they can't help it. They're not in the right mind. Yeah, they were verbally abusive, but we're going to try to work through that. Switch to meds. I mean, we come up with every excuse in the book to try to make sure that we continue caring for these people because that's what we want to do. And that's what we need to try to do for these patients who don't necessarily have the kind of advocate that Mrs. Bland had.
Absolutely. And bless her family for really stepping up and trying to save the next person.
Absolutely. Without a doubt.
Along with mental health issues, comes along the opioid crisis.
Yes.
And so now we have a lot more people who are being arrested and jailed who are, dependent on some type of drug, whether that's alcohol, prescription, an injectable. Nowadays, honestly, you can be addicted to whatever form. So in this area in which jail health care is increasingly relied on is by default. Like most times people that are getting arrested, their first stop is jail. Their first stop isn't to a detox. This is like they're being picked up because they've maybe
overdosed or got into a
pick
bad
up
situation.
Some drugs to get their next fix.
Right.
They've overdosed and now they're in jail instead of being taken to a detox center.
Right.
Or a substance abuse center.
And jail's not the place to detox safely from anything.
Absolutely not.
I mean, I'm not trying to be funny, but that they're not healthcare providers, and there are a lot of consequences to coming off some of these drugs.
Well, according to the CDC, more than 72,000 people have died from overdoses. That's almost 200 people a day. This is how much
crazy.
Of an issue it is, and instead of treating them medically, we are locking them up in jail. The CDC had also reported that overdoses now constitute the leading cause of death among Americans under the age of 50. And many people suffering from addiction pass through jail on charges related to their habit.
Right. Stealing to, get money for their drugs or whatever. Research has consistently shown that community-based drug abuse treatments can reduce drug use and drug-related criminal behavior. So this goes back to, to me, basic nursing and research. Every time we do any kind of podcast on something like this, education is always the way to make it better. Who would have thought?
Imagine that.
Huh. So there was an analysis of 78 comparison group community-based drug treatment studies. And what they found was that community-based drug treatments were 1.8 times better in reducing drug use than any alternatives. So getting them to the proper facility to recover from drugs is better than throwing them in jail.
Absolutely.
I mean,
the chances are you help treat their ailment, they won't be in jail.
Right. And then, exact. I mean, like I said, and in another analysis of 66 incarceration-based treatment evaluations, therapeutic, community, and counseling approaches were 1.4 and 1.5 times more likely to reduce reoffending. So even if, so they've done something wrong. A person's done something wrong. They've stolen something to get money for their drug addiction. So now they're put in jail. Well, instead of them going to jail, they go to like a rehab facility, and then maybe once they're out of the rehab facility and they're safe, they do their time for their crime that they did. And while they're incarcerated, they still go through counseling, therapy, how to, re-enter the world, and they come out, they do a better job than people who go to jail, get clean while they're in jail because there's no other option, and then get released.
Well, how many times just in nursing period have we been told you can't take away a behavior without replacing it with one?
Exactly. That's what they tell you. You don't just change everything at one time. If you're trying to lose weight, instead of going for the chips, if you want something crunchy, go for an apple.
You have to change the old behavior with a new one, a healthier one.
Right. And so you make that one alteration. Or instead of going from soda to water, go from soda to some kind of flavored carbonated
diet
spritzers or whatever.
Yeah.
So I don't like this. I've tried. I can't do it. And you just kind of step down. And the whole point of that is you're taking one thing, you're replacing it with another, and you try to make it healthier, better
Each
every
step
time.
of the way.
And those behaviors stick with you better. So same concept with drugs. So we're going to take away the drug. Now we're going to replace it with something else. And so that's where you get into the counseling and things like that. And, and understand in a lot of these facilities, there's not a lot you can do, but a lot of them have recreational things like, a weight room, exercise and things like that. They do offer something. So it's not like, well, what are they supposed to do? They do have things.
Have AA, they have NA. They do have things, yes.
So drug courts combine judicial supervision and drug treatment as an alternative to incarceration. Their graduates have rearrest rates of about half of those with the same demographic compared to like people who just kind of dropped out.
Wow.
So that's huge.
That's a big difference.
Yeah, absolutely. Because these are people who are being reformed. Individuals who participated in a prison-based treatment plan followed by a community-based treatment plan after incarceration were 7 times more likely to be drug-free and 3 times less likely to be arrested for criminal behavior than those not receiving treatment. So it doesn't even matter, honestly, according to these studies, what kind of treatment you have. If you have some kind of treatment while you're incarcerated and a follow-up community-based treatment afterwards, you're leaps and bounds above anybody else.
Absolutely. The whole point is to be productive, make productive members of society. You have the opportunity to change life, literally. Change life.
And you are who you hang around. I'm not trying to be funny, but when you put these people, I say these people, that sounds so bad. When you put people who have a history of drug abuse or drug addiction into a facility where they are around other people who are trying to get help and better themselves versus just sending them back to the same
behavior
lifestyle
that led them to where they were,
you can see why it's a lot easier for them to kind of drop back into doing everything they used to do, because it's, oh, hey man, you finally got out. Let's go get together and go out. And then there you go. It's done. As to where these people who come out of prison and they go to a community-based program and they're like, oh, well, hold on. I have a new group of people that I can rely on that are there for me that are also trying to do better for themselves. Makes a big difference.
It sure does. The benefits of medications for drug treatments were shown in a recent randomized trial in which heroin-dependent inmates began methadone treatment in prison prior to release and continued in the community post-release. At 1, 3, and 6-month follow-ups, patients who received methadone and counseling were significantly less to use heroin or engage in criminal activity than those who received only counseling. The potential exists for immediate adoption of methadone maintenance for incarcerated persons with opioid addictions, but most prison systems have not been receptive to this approach. Do you think it boils down to the dollars and cents?
It's always about money. I mean, there's just...
For me, I feel like that's the root of it.
What I don't understand is, I feel like, and I say we, and I mean, when I say we, I mean like as a nation. We're always like, we need to do better. We don't want, our people in prison. That costs federal funding and government money and blah, blah, blah. Well, put something in place that has statistics behind a proven approach to decrease rearrest. That means there are going to be less people in your correctional system, period.
Even that boils down to dollars and
so
cents.
Now I'm like, well, do you really don't want them to come back, or do you really need them there so there's money coming in? And that sounds awful. And
I think that's the reality of it. And I think if we weren't sitting here having this conversation, it would continue. And that's the whole point of having this conversation. People who go into jail, they are a dollar amount.
Yes.
The longer they stay in, the more people that join them, the government is making money and they're getting kickbacks from that.
Yeah, there's all these for-profit organizations that literally profit from them being in jail.
They're incentivized to keep people in the system.
Right.
That's why we're doing this podcast, because the system has to change. It has to be broken. It has to change. We need to start treating people instead of just simply locking them up and throwing away the key.
Right. And this is where it all comes back to educating. And I mean, and just to be very blunt, prisoners have nothing else to do. So put them in counseling, get them educated, and move on. Because it's going to work. Will it work for everybody?
No.
Heavens no. Not even a thought to cross our mind that, we can reform everybody.
Yeah.
No.
We're not going to be able to save everybody.
We're not. That's a fact of nursing life that I think that all nurses, once they get out of school and they realize that they can't save everybody and that there are patients that are not going to listen to them no matter what. But the thing of it is if you save more than you lose,
that's progress.
That's progress.
Oh my God. Light bulb moment.
Yes.
Okay.
So not treating drug abusing offenders is a missed opportunity, and not only will that help the system, but it'll also help the public. Because what happens to people once they've done their jail sentence?
Let me tell you.
They're released.
Yeah.
Back into society. So we want to try to integrate the systems to try to make it to where treatment into the criminal justice system would provide, treatment to individuals who otherwise would not receive it. And what also that can do is improve their medical outcomes. So what I mean by that, say they have a mental health issue, they don't realize it. But we're doing our screenings and our appropriate things, and they're being seen because they're in jail or prison, and they have to, because that's part of it.
Yeah.
And all of a sudden you realize that you have bipolar disorder and you need to be on treatment, and then you're put on treatment, and then you're in a better place. Well, when that person leaves and they go back into society, they're in a better spot because they know what's wrong with them and they can seek adequate treatment.
Absolutely.
So
the best way to defeat addiction is to guide people toward a long-term treatment, which is what we've pretty much been talking about this whole entire time.
Yes.
access to methadone or to similar drugs that can allow them to either safely maintain their opioid use or gradually reduce it to stop.
Yes.
This is a medical health condition. Addiction is real.
It is.
Whether it's heroin, alcohol, nicotine is addictive. People can't quit smoking. This is an illness. Yes, nobody's actually died from like nicotine overdose to the best of my knowledge, but it's still an addiction, and it works in the same routes, that alcohol and heroin work. So we need to do better.
Yes, agreed.
The prison population of the United States has quadrupled in the past 25 years. The U.S. now incarcerates more people per capita than any other nation. And according to the Innocence Project, there is an estimated 1% of the prison population that is innocent. This percentage may seem low, but this would mean approximately 20,000 men and women that are sitting in prison right now who are innocent. And in addition to this, each person costs the prison system approximately $34,000 a year. That would mean we are spending $680 million on innocent people in jail per year. If we improve management of chronic conditions in prisons and jails, it would have an important role for our community health and in reducing healthcare disparities, because the vast majority of inmates are eventually released. Approximately 12 million inmates are released every year. And if we actively treat inmates' physical and mental disability, it would make integration into the workforce and society smoother.
$680 million. I wonder how many methadone clinics we could open with that.
So true.
There's your money right there. And that's for innocent people that are just people who aren't even supposed to be in prison.
It's crazy. We have to do better.
As always, we will link our references to our website, thenursingpostpodcast.com. We would love for you to join in on the conversation, and you can leave your comments below. Be sure to subscribe to our podcast, and you can listen to us on your favorite platform, and you can also follow us on social media. Thanks again for listening to The Nursing Post.